My name is Elena, and I'm going to demonstrate thumb extension of the Extensor Pollicis Longus and Extensor Pollicis Brevis. I'm going to begin by asking the patient to place their hands supinated on the table. To test the Extensor Pollicis Longus, I will stabilize the proximal phalanx. For a grade of trace, I will ask the patient to extend the IP joint and palpate the Extensor Pollicis Longus. So extend your IP joint and I'll palpate here. Okay. For a grade of 2, the patient will demonstrate partial range of motion. So can you please extend? Good. For a grade of 3, the patient will extend through full range of motion. So can you please extend? Okay, and I'm going to get an end feel. For a grade of 4, the patient will extend the IP joint through full range of motion, and I will get an end feel. So can you please extend? Good. You get an end feel. Okay. Now I'll apply a moderate to minimal resistance through the full range of motion. Okay, now extend, push, push, push. Good. And with the grade of 4, I will test the other hand also. Now for a grade of 5, the patient will extend the IP joint through full range of motion. Extend, please. Good, good, good. Apply resistance. Okay. Now one more time, and I'll apply maximal resistance. Push. Good. And I'll get an end feel. Okay. And with a grade of 5, I'll also test the other hand. Thank you. Okay. To test Extensor Pollicis Brevis, I'll stabilize the metacarpal. For a grade of trace, I'll ask the patient to extend the MCP joint, and I'll palpate the Extensor Pollicis Brevis. You extend? Okay. I'm going to palpate over here. For a grade of 2, the patient will demonstrate partial range of motion. Good. For a grade of 3, the patient will demonstrate full extension, and I'll get an end feel. Good. For a grade of 4, the patient will extend the MCP joint through full range of motion, and I'll check the end feel. Good. Now I'll apply moderate to minimal resistance through the full range of motion. Push. Good. And with a grade of 4, I'll also check the other hand. Okay, for a grade of 5, the patient will extend the MCP joint through full range of motion, and I'll check the end feel. Good. Then I'll apply maximal resistance through the full range of motion. Push. Okay, now I'll check the end feel. Good. And with a grade of 5, I'll also check the other hand.